As an historian, it's important to keep your eyes peeled. Sources are all around us. We're here in Liverpool, where I'm from, and I've often walked past this pub, Dr Duncan. Now, I know he was a real person. He must have been someone pretty special that they've named the local pub after him. So let's go and find out some more about him.
Looking around, I can see that Dr Duncan became Liverpool's first ever medical officer of health in 1847. That's interesting, but I could have found it out elsewhere. What I'm really discovering is evidence of his historical significance.
This pub is a great source. It tells us a lot about the status of Dr Duncan. We can see that he was an important person. The whole pub's themed around Dr Duncan. There's medicine cabinets everywhere. They've got posters like this which they've made which describe him doing great work for the poor in the city. So we get a little bit of a sense of who this man was, why they've bothered to actually name a pub after him.
During the 19th century, when Dr Duncan was working, Liverpool was a huge gathering point for thousands of poor migrants, and this is all that remains of the kind of housing they lived in. Hundreds of people would have crammed into these few houses in Pembroke Place. Conditions were filthy and overcrowded, death rates were the highest in the country. Diseases like cholera and typhus fever spread rapidly across Liverpool. And Dr Duncan dedicated his life to improving these conditions and reducing death rates. I'm here at Liverpool's Central Library and Records Office to explore some sources that show how he went about it.
I have here a great source. These are some of his early reports on the conditions in Liverpool when it came to public health. He's talking about it having an unusually high mortality rate. And so he decides he's going to try and do something about this. He says here that it's necessary to improve the sanitary condition of the town generally, that impure air and moisture had mostly been observed in connection with cholera. So he says what we need is effective house and surface cleaning, court and cellar drainage, and the drainage of pools of stagnant water. He says, with regard to the cleansing of filthy houses, I've thought it desirable in the case of the poorest class of the population that notice should be served on the owner rather than the occupier. So he's making real inroads here into improving public health by improving the condition of the working class through the landlords.
Dr Duncan set in motion schemes to reduce disease by improving sanitation in homes, cleaning up the water supply and encouraging the building of sewers. Death rates began to fall. But did that continue? I'm looking for a source that can tell me what happened to public health here after Dr Duncan died. And I found one.
This is a really wonderful source produced by the City of Liverpool. It's charting a century of progress in public health. And it starts straight away with Dr Duncan. It's talking about him as being very innovative. And we can see these innovations when you look at this huge contrast between what happens over the 100 years. It says in 1847, the life expectancy for a child born in Liverpool was 19, whereas by 1947, it was 55. So it's certainly moving in the right direction. And there are some really good graphs in here which give a sense of progress. We can see that from the 1840s to the 1940s that the population was going up in the city. And we also see over here that Liverpool's death rate was steadily declining. Conditions got better in the city, public health improved. So Dr Duncan made a real impact in Liverpool. It's interesting how a source in an unexpected place can set us off on a journey. We saw from Dr Duncan's pub that this was somebody really important locally, and we saw from his reports that he was really concerned with improving public health conditions. We saw from the pamphlet that he was successful at doing that.
I can see now why people here in Liverpool wanted to find a way of commemorating Dr Duncan. He really did lead the way in transforming the health of this great city. And that's why he's become a feature of Liverpool's landscape.